Dear friends, greetings from Association of Sasidharan Urologists, India. I am Dr. Vinod KV, urologist working in Trivandrum. We have with us a great pioneer of Indian urology. He is a gifted surgeon who has put smiles on thousands of patients suffering from urology issues. He is a great teacher who has trained hundreds of urologists in India and abroad. He is a great clinician who has solved so many complex and challenging cases in urology. He is a great orator who has mesmerized the scientific community with his words of wisdom. Above all, he is a great human being who had shown limitless compassion to the patients he treated in urology. Dear friends, we have with us Professor K. Sasidharan, who has been the head of the Department of Urology in Medical College Thiruvananthapuram and Calicut Medical College. He has also led the departments in SWIMS Tirupati, and he was the head of the department for a long years in KMC Manipal. We welcome Professor Sasidharan sir for this interview. Welcome sir for this interview. This is a series of interview organized by Association of Urologists, including all the major stalwarts in urology in the South India. Sir, you were actually trained as a surgeon to begin with, and then you felt that there is a different specialty or a need of specialty called urology. So you were the initial pioneers venturing into this field of urology. So what was your experience at that time?
To start with, I must say that I was lucky to begin my surgical career. I was trained in Calcutta. I did my schooling and medical college and everything in Calcutta. I was actually working under Professor Bimal Mukherjee. He was a urologist. In fact, he was the president of the Urological Society of India for some time. And so I was working after my graduation as his house surgeon. And he was obviously a committed urologist, and I picked up the interest of learning urology from him. And subsequently, I shifted to Delhi University, where I was initially working in GB Pant Hospital, the super specialty hospital. And later on, I shifted to Sasidharan Hospital, Delhi. And Delhi was actually one of the stone belt areas. So I was accustomed as a postgraduate student and as a surgical registrar to deal with a number of urological related diseases, especially stones. So my interest was further accentuated by my stay in a stone belt area. That's how I got interested in urology.
So was it the courses, training courses, how it was available at that time, or you had to find great difficulty in getting access to a training program?
After MBBS in Calcutta, I thought Delhi would be the best place for MS training, because in Calcutta at that point of time, Calcutta University at that point of time did not have a kind of a formal MS training. You register yourself and then you continue for years and years, but so that is not a good thing to follow. So that explains why I shifted over to Delhi, where we have a regular MS training program. And as I said before, I was in GB Pant Hospital. It's a very prestigious hospital in Delhi. And my guide, Professor B.P. Goyal, was transferred to Sasidharan Hospital. It's all under the government, central government hospital, auspices. And there I continued with my MS course. And even after MS, I continued there as a surgical registrar, post-MS surgical registrarship. That also provided me plenty of opportunities in dealing with urological ailments and diseases. And there also I had exposure to pediatric urology. I was in fact the surgical registrar of Tripta Datta. She is a renowned pediatric surgeon in Delhi. So she was doing a lot of urological cases like pyeloplasty, hypospadias, and things like that. I mean, there's a lot of urological problems in relation to pediatric surgery. So I was lucky that way, and both adult urology as well as pediatric urology.
So you have carried that fire of pediatric urology, pediatric urologist to that extent, and you have published a book also in that specialty. So how is your relation with the pediatric urology, sir?
There are a lot of opportunities for me to practice pediatric urology because Tripta Datta, as I was telling you, was a quality pediatric surgeon with a lot of pediatric urological interest. And after completing my MS and the related training in Delhi, I shifted over to CMC Vellore. CMC Vellore at that point of time was a phenomenal center because it was headed by one of the greatest Indian urologists, Professor H.S. Bhatt. And he had a lot of pediatric urological interest. And in fact, he was one of the first surgeons who performed ureteric tailoring, hindrance. We used to do a lot of such cases, and so I had an exposure to that sort of surgical enterprises, ureteric tailoring. And one advantage of being in CMC Vellore, since CMC Vellore was very well known throughout India, a lot of eminent national urologists used to periodically come to CMC Vellore and spend few days with Professor H.S. Bhatt. For example, Kollabawala, Karinjiwala, and Sonawala, all renowned Parsi urologists, and Dr. Himandri Sarkar from Calcutta. So they used to periodically visit CMC Vellore, spend some time with us. So that provided us an opportunity to be trained by them also. So they used to conduct clinics and they used to discuss cases. So there were a lot of advantages for me by doing MS training and MCH training at CMC Vellore. And not only getting trained by Professor Bhatt, but also getting exposed to other many eminent urologists of this country at that point of time.
So sir, actually you are very lucky to have worked and trained under so many big names in urology. So Dr. H.S. Bhatt is a well-known name to all the urologists across India, and he is considered as a father of Indian urology. So how was your relation with Bhatt, sir?
Excellent, absolutely. No room for complaint at all, because he actually, I should say, liquidated all kind of existing paradigms of postgraduate teaching. There's no distance between the teacher and the student. He used to say, we're all students, in fact, working and learning under one canopy. And so that distance was reduced. So we were so comfortable in talking to him, discussing problems, and even questioning him, He, in fact, wanted that sort of attitude from the students. So that broadened our urological perceptions and accentuated our desire to seek knowledge. And to put it mildly, he expanded our urological horizons. He was an excellent chief and intensely concerned with the welfare of the postgraduates. And another important thing which I should tell about Professor H.S. Bhatt, which is very relevant and valid for the current postgraduates, teachers. As a teacher, of course, one is inclined to transmit the technical details to the student. But more than that, there are a lot of other responsibilities. For example, a teacher should enhance the candidate's articulatory skill, his writing skill. In fact, Dr. Bhatt transformed all of us into quality wordsmiths. He was very particular how we talk and how we scripted the discharge summaries, and so that way, we learned a lot of things. We not only learned quality urology, but a lot of corollary things, collateral things. So that way, it was very, very useful.
So your writing skills and communication skills are are incomparable when we see with other urologists, because you have a very good command on the English language. So all this have come through a rigorous training, and the scientific language you express when you are in your discussions, it's all phenomenal. So you have a lot of things acquired from Professor H.S. Bhatt and incidentally Dr. Sanjay Bhatt, who is a son of H.S. Bhatt, happens to be your training.
Yeah.
So how do you look at it?
Yeah, excellent. That's actually, see, after all, postgraduate teaching, not only in urology, but in your specialty, is like a relay race. You run for some time, transmit your baton to the next man, and then he runs for some time. This goes on and on. And the important thing is that what we have acquired from our teacher, the skill, whatever we have learned, is not actually our own. We owe a lot of things to the ambience in which we prospered and survived and still continue to survive. So that will have to be transmitted to the next generation. You cannot just be selfish. This is I got this knowledge, I should hold on to it. No. In fact, I would go to the extent of telling that teaching the best way to acquire knowledge. So I tell the postgraduates, and when I take pain and explain everything to them, so I take so much of pain because I know one day you will become a teacher. So I have to train you to become a teacher. Not only the technical skill, but a lot of things to be taught and transmitted. Sanjay, of course, was a great, actually when I was doing MCA and CMC Vellore, he was a small kid going around playing and, hunting birds and things like that, So it's a great feeling to see him grow up and acquire, father's skill. And in fact, he worked with me in Manipal for some time. And
Sir, it is actually the same. If you are looking at it, you are seeing urology growing up in front of you.
Yeah, absolutely.
By taking some baby steps. Initially, it would have been a very difficult situation to create a department, getting all modern equipments and things like that. Mm-hmm. So you have been leading so many departments. So how do you feel as a leader in urology in setting up the department and the difficulties? How difficult was it?
In government setup, there's a lot of problem because fund is not readily flowing, and that's one. And secondly, a medical college, specialty department do not exist alone. It exists along with a lot of other departments. So you need help and support from your sister departments. Sometimes that may not be readily forthcoming. So that way we have difficulty. But nevertheless, if you provide the right kind of leadership, even with the meager resources and infrastructure, you can build a good department. And that's what we have done in Trivandrum and in Calicut. Calicut, I was extremely fortunate to be an associate of Professor Roy Charlie. He's a remarkable man, and his contribution can never ever be underestimated. A great teacher, a great surgeon, and a remarkable man in many ways. So it was my luck to be associated with him, and for a long time. Long time means in government language, just 5 years is a long time. And I was there for 5 years. Then I was subsequently promoted at the head of the department here, and Trivandrum Medical College, and then I worked here. Later on, a very decent setup was coming in Tirupati under the auspices of TTD Devasthanam and Government of Andhra. So I thought that'd be a challenging proposition. So I shifted over to Tirupati. I built up the department and gained some national recognition. And at that point of time, the Manipal group invited me. So I went there and stayed for 10 long years.
So when we were students studying even surgery, the departments of urology set up by you were the mecca for all the urologists. It was almost the center point for all clinical discussions and difficult surgeries, and your training and your great words were an inspiration for all the young people at that time. Now, sir, you have seen the baby steps of urology, and now you are seeing it being split up into so many subspecialties. It has grown to that level. What is your perspective of looking at these subspecialties?
I think subspecialties will have to develop, and the urology per se is one parent department that's being divided into a lot of subspecialties. That's bound to happen. That's not only true for urology, but in all specialties. So I feel that probably this 3-year course may not be sufficient, and it has to be enhanced for perhaps even 5 years. Just like American fellowship training, we have to increase the length of the duration of the training for our postgraduates. That's one. And then, after the advent of this corporate sector in a very big way, I begin to wonder whether students are getting hands-on experience. Because the consultants, obviously, they'll have to build up their own practice, and then and a patient goes to a private setup seeking a particular consultant's skill. So he doesn't want to be operated by anybody else. So that is a peculiar kind of arrangement. And as a result, quite often I find the postgraduates don't get hands-on experience. And I may be too harsh, or maybe brutally frank when I say, there's a lot of slave labor exists in the current setting. Don't misconstrue me as being very harsh or so, but you tell the truth. In fact, that is a report of many of the postgraduates. So we are not getting hands-on experience. We're just going around and doing all kind of clerical work, discharge and history and support and holding the retractor. But occasionally we would like to get some more. The advantage of increasing these training courses, the last year can be purely confined to hands-on experience. So by the time he comes out of the institution, he is experienced in some way. But that's how the individual remains loyal to the institution. To be very frank, I stand to be corrected, but as far as if you ask the loyalty of the present postgraduates to the parent institute, it's very frugal, it's very meager. They just get the degree and go off. They never revisit the parent institution. And many institutions, they don't have an establishment called alumni association. See, for example, we continue go to CMC Vellore. We are still loyal to that institute. And that kind of loyalty, I'm afraid, is not there at the moment.
So you have initial training. At that time, the training program was very lax, and when we are doing MS and all. So Indian system of training was not that very much well structured. Then you have headed so many departments. What are your suggestions for improvement of these improvements in training residents?
See, the problem is, see, for example, I'll go back to the corporate sector. In the corporate sector, there is no department as such. There is no urology department. There are only urology consultants. See, Manipal is a private setup, but there is a department. There is a department and different units all working together, discussing together. You know, we used to, in Manipal, we used to sit and plan what we have a strategy evolving session. Then morbidity and analysis. Even the slightest, a problem is a morbidity. So that is being analyzed. And everything is analyzed. And there's interdepartmental meetings, pathology and urology, radiology and pathology. That's all because there's a department of urology. See, for example, KIMS, I'm attached to KIMS. I'm loyal to KIMS for that matter. But there's no department. If there's a department, let there be separate units. Let there be separate consultants. But there should be a unit. Only a unit can hold on and continue with all these, academic discussions and if suppose a unit should have a head of the department, department should have a chairman. Chairman can rotate, but there should be a division of the department. Unfortunately, it is not so. I'm sure you would agree with me, no?
Yeah.
Huh? Yeah, that is the thing. So let there be consultants. There will be private hospital. You can't annihilate the corporate sector, not at all. They're doing great service. But they should reorient themselves. And see, for example, 4 or 5 consultants, how many times they sit together? How many times they sit together and talk to the postgraduates? They're all sequestrated. I'm not against consultants. Obviously, consultants should be there. But let there be some semblance of a department. There is no inter-department, intra-department, no meeting at all. There is no pathology, urology meeting, no radiology meeting, nothing.
So everything is getting fragmented.
Yeah, fragmented. I think all because why we should get together. See, if both of us are working as consultants in the institute, you have a view of management, I have a view of management. I'm not right, I'm not wrong, you are not right, you are not wrong. But we can always discuss and transmit to the student. See, one problem can be looked at in different ways. But the student should know what are the various ways of looking at it. But unfortunately, it's all, single line kind of single.
But in government hospitals, especially in medical colleges, we have all departments, teaching hospitals. So is there anything you have as a suggestion to improve the residents?
See, the government, the government setup, there's a lot of intra-departmental conflict. See, for example, there are some departments in medical colleges where the consultants working in the same department, when they walk through the corridor, they don't greet each other. I'm not exaggerating at all. And suppose the PG is allotted to you, you tell him, you stay with me. That's all, that's the end of it. And throughout the 3 years of training, he's tethered to you. I mean, how can he have a very broad-based, perceptions? And also, see, for example, and if we are working together, if I have a problem and a difficult clinical situation, I have no hesitation at all walking in the office. You may be my junior. Still, I'll ask him, Vinod, what do you think about this? Will that happen in medical college? You also, worked in medical college, isn't it? I'm frank, but when you ask me a frank question, my answer also should be very frank.
So, sir, you have been the chief editor of Indian Journal of Urology, and you have been the instrumental in bringing up to this big level at that time. So, how, the number of the research publications happening from India has been on the lower side. Even from the beginning, and even now it is not very much different. So what is your suggestion on improving the research and publications from India?
I think we have got a lot of clinical material. And see, for example, I published quite a lot of stuff during my career, because after all, when you write a paper, you are transmitting your cumulative experience. What you have seen, the do's and don'ts, and most of the paper have a message, and that message would spring from your cumulative experience. And see, when I was editor of Indian Journal of Urology, I find some of the papers are good. The material is good, but badly put, badly written, badly crafted. So, quite a number of times, I have rewritten the article. You won't believe, I've rewritten the article because the material is good. There are a few good papers, and see, I was associated with the Urological Association of Asia in a very, very big way, and I have traveled all over the Southeast Asian countries as an invited speaker, and I was also a member of the steering committee of International Consultation of Urological Diseases. That is a very formidable body at those times, under the auspices of UNESCO and WHO. We hold our meeting every June of every year. 1 month we'll be there, and epidemiological work and all kind of things. So during those periods, I find the material coming from India is less because they don't come out. They're very hesitant to write articles, despite the fact they have good material. And that's why I said a good teacher should not only teach the technical aspects of a surgical technique, but also many collateral things, everything. And the way they articulate, they speak, and and language. And see, for example, I remember when we were with Professor Butt. The Sunday is remarkable. Every Sunday, detailed rounds, and we go to the canteen, and in the canteen we sit and talk. Nothing urological. He'll ask about movies. Did you see that movie? Have you read the book? That's a lovely book. Then I'll say, I have read the review. No, you should read the book. Not a urological book. Lot of general stuff. So a consultant should not be constricted. And so when I tell, like this, many people may think I am talking utopian things, but no, they are not utopian. And all this is possible only if you have a department. If all the consultants going different ways, the pathologists will look her way, and like it's like that. And
actually, you have shared a great experience, sir, because in a department, each person is very important, and the other departments are very important, and everybody is working together to create a new theme, a new research product, and a new result for the patient, and that might have helped to grow urology to this extent. And the dedication you have shown in writing the article for some other person, I think no other editor in this world would have gone to that extent. And that is exactly the reason why the urologists in India consider you as a great teacher, and you are going to that big extent.
And one important thing, and I would like to say, I was there for 10 years in Manipal. And there, a lot of my faculty members go for conference meeting, and they go and all that. Believe me, I have never extracted a leave letter for any one of them. And I also have not given any leave letter to the management. Because if you go and present a paper, you're projecting my department, your department, CMC, KMC Manipal. So should I tell, well, no, you're supposed to come today. When did you come? When did you do this? Don't do that again. That sort of thing I never ever done to my team in KMC. It is how that trust begets trust. If you believe in somebody, I'm sure you'll have a return. Which is quite substantial. Don't you think so?
Yeah, sure. So you have been a great teacher. Above that, we all consider you as a great human being, having so much compassion to the patient. So whenever we see you, we always think, how are you managing in a corporate sector, and how do you feel when you are treating patients? Will you be able to do a compassionate work in a corporate sector? What was your experience with Manipal?
Manipal I can do it. Manipal, the management was so good. They won't insist on everything, but other corporate sectors we may have problems. And suppose you are working in a corporate sector, and a very interesting case is coming up, and which will require really extensive imaging. For example, CT, MRI, or vascular study, things like that, and things like that. But the patient is very poor, and of all these imagings, the cost put together, this gentleman cannot afford. If the management is intelligent, if it is generous in a way, you will be able to do all this investigation, because doing that particular case will improve your surgical skill. You'll be able to teach your postgraduates about that particular case, and the institute benefits, because a complicated case has been done, no matter the wealth of the individual. But that is not possible in a corporate sector. If you cannot afford, you cannot afford. We cannot go ahead. But in Manipal, if I say tell the management, I'm telling about that point of time, I don't know about now. This is a very interesting case, we have to do this. Yes, go ahead. Because doing that is extremely important for you. For publication, a paper, if you have a series of cases like that. See, after all, the cases generate papers, no? So, I mean, every management should have kind of internal funding. Internal funding, but that's not there. But medical college, of course, I mean, many things can be done. But there are a lot of, medical college, the main problem is the intra-departmental problems. The unit heads don't get together. And they consider themselves as rivals, not as friends. And I never had this problem with Professor David Joseph. Professor Roy Charlie. Never had the problem. And he used to ask me to come and assist him. I used to come and I used to request him to come and give me a hand. Absolutely no problem whatsoever.
So you might have done all sets of cases in neurology, seen almost all cases in neurology, all different subspecialties. You might have a great experience. Which is one subspecialty which is close to your heart?
Obviously, pediatric urology, I like it very much because there's a lot of challenge involved. And, the ureteric reconstruction, the ureteric tailoring, and that is a very precise surgical exercise, and I love to do it. And, the bladder augmentation. See, I worked in many areas where tuberculosis was endemic. So we had a lot of opportunity to deal with difficult, complicated cases, contracted bladder and the ureters and all damage, and that sort of. Then another area which I love to perform and indulge myself is intrarenal surgery, complex intrarenal surgery. Because when you undertake a complex intrarenal surgery, two important components are hypothermia and vascular control. And nephron sparing, I've done a lot of nephron sparing. Because in fact, if you go through the old programs of our Urological Society of India, many of the nephron sparing surgery papers had come from me actually. And see, especially when you deal with tuberculous lesions in the kidney, and you want to do some of the cases under hypothermia and circulatory arrest, you may not be able to get at the pedicle because the perinephric environment is vitiated by the tuberculous process. So there, the cooling has to be done by transfemoral route. I've done that on quite a number of occasions, and this technique, transfemoral route of, radiologists will, of course, they call it radiologists is required. You puncture the femoral artery and then put the catheter and blockade the renal artery and perfuse. And there are problems and a lot of things. At this point of time, you can't elaborate that. And that I will love to do it, and I've done that quite a number of times. And the complex intrarenal surgery, like AV malformations and infantile stenosis, reconstruction, and a lot of things I like. And
so from the beginning of your career itself, you have been part of all the associations in professional organizations in India, Urological Society of India and Association of Southern Urologists. And you have been the president of Urological Association of Urological Society of India and ASU. So what is your memories about your relationship with the professional organization?
Excellent. For example, the South Zone Urological Association, we had the first meeting in ERCOT. A lot of very interesting people were there. Professor Roy Charlie, Ranganatha Rao, and Professor Chisbat, and then Ganesh, my very close friend, Ganesh Gopalakrishnan, Tanigachalam from Chennai is no more, Tanigachalam is no more, Ashok Kumar is no more. Professor Venugopal, my senior in Manipal, the great, extraordinary human being. And we all met together to have the association at camp. That's a very memorable occasion. And that point of time, there's one point of debate whether the South Zone Urological Association should be an autonomous, independent body, totally detethered from the Urological Society of India. So that was a big debate going on, and at that meeting we didn't come to a conclusion because there were some vociferous individuals. No, we should be independent. We had nothing to do with. But fortunately, many of us were not parochial. All of us had a nationalistic outlook, and then we decided that they should be a part and parcel of USI, but still we maintain, a different color. And you can have, something like, 370, Article 370 in Kashmir, something akin to that. You can have a 370 for South Zone Urological Society. We are part of it, but still we are not entirely part of it. And we continue to exist. And
how do this association help in shaping of the urological training and research as well as the practice?
Yes, in fact, we have a lot of subcommittees. For example, the first ever subcommittee for pediatric urology was headed by me, and I was a convener. Dr. Shyam Joshi, a remarkable man, he's not with us. And Dr. P. Venugopal, we were there. We together planned all these. We schemed. Before the meeting, we said, I'm going to shout at you, you shout at me, like that. So that we want to convey the messages to the postgraduate. Very lively discussion, hot, noisy, and people at a distance, these characters are fighting. But we were fighting for a cause, because we want to say, because there are always two, three ways of doing a thing. And the PGs should know, the postgraduates should know. So there were many committees, and then fellowship programs came in, a national board, and so they all came up gradually. There's a steady phase, and so that was there. And see, for example, CMC Vellore, and that is the center which has produced the maximum number of Urological Society of India presidents. Professor H.S. Bhatt was there. Then Dr. Venugopal was there. He's from CMC Vellore. Ranganatha Rao, A.P. Pandey, then Dr. Sasidharan, then Ganesh Gopal Krishnan. A spate of one after the other. So much so, it was said CMC produces a factory producing Urological Society of India presidents. So societies have come in a big way, and of course there are some intramural conflict. Every society, if there is no conflict, that's not a society at all. So we have, but we never had an unhealthy kind of competition, and there's absolutely, to the best of my mind, there's never ever be a regionalism, a shadow of regionalism in our interactions. In fact, I was the first secretary of Kerala Urological Society, and Kerala Urological Society is one of the earliest state societies in South India, and so some of us who framed the bylaws of Urological Society of India. We decided this will be a national society. A Tamilian can be the member of Kerala Urological Society. So we kept it open, and we'll also conduct the Kerala Urological Society meeting anywhere in India. We are going to Sri Lanka, we are going to Malaysia, we are going all over the place. So we are absolutely broad-looking, and we are not constricted individuals. So there was an interesting debate when South Indian Urological Association was formed whether we should be completely sequestrated and detethered from, and that's the only debate which was very hot. And fortunately, we are still a part of the Urological Society, so the Society of India, but still we have a different color with different thing.
And last but not the least, sir, can you share the details of your family also to the members?
Yes, and I lost my wife about 5 years ago, and that's a great loss, and I haven't recovered as yet from the shock, and losing a spouse is not an easy joke at all. And I got one daughter, and she's an environmental scientist, doing a lot of work on her own, and so like that, and a very small family. And my wife's sister, Dr. Radha, is a pediatrician in Calcutta Medical College. And she lost her husband, who was a pulmonologist, recently. And my brother-in-law is Ramanguti. You may know him. And he's a very well-known epidemiologist and attached to Sri Achumen Center in Chitra Medical Center. So we are a small group,
thanks for sharing your vast experience, sir. It was a great experience to have you with us, and I thank you for your time on behalf of Association of Southern Urologists.
It's my pleasure, Vinod. I must say, during my interview, I was very frank sometimes, because there's no point in concealing anything. You have to have a frank discussion, and then, that's why I have nothing against anybody. Everyone is my friend, and
So thank you, sir.
Thank you so much,